as a Black woman, you get a deluge of information that says you're gonna die, you're gonna die, you're gonna die. Black women die. We often talk about survival rates, right? We talk about how well patients are gonna survive. We talk about how well they're going to do. But when we talk about Black women, we talk about how well they're not gonna do. That is what is the first thing that I almost always hear about disparities. It is scary to hear that.
My name is Dr. Lori Wilson. I'm a cancer surgeon at Howard University Hospital in Washington, D.C. I was diagnosed in 2013. I was a mom who was getting back to work, and so I breastfed for a year. And after I stopped breastfeeding, what the expectation is that your breasts will go down, and one of my breasts didn't. And so knowing what I know and doing what I do, I knew that that was a problem. Honestly, I was expecting the diagnosis of breast cancer. But I wasn't expecting was that I had a breast cancer on the other side as well. I went on to a whirlwind treatment. I started off with chemotherapy. I shaved my head with family and friends around. My husband shaved his head. My brother-in-law shaved his head in solidarity. And then we went on to mastectomy on both sides. Surveillance for me was management with a medication that blocked estrogen. I was actually doing really well until January of 2019. And after 5 years, you kind of think you're mostly in the clear. But what I found is on my way home from work, and I was just thinking, wow, I have a real back pain. And what I found when I went to the emergency department was that my cancer was back. And for me, my cancer was back in my bones, and I also had cancer that was in my liver. I just got my most recent CT scans, and what I found out was that all of the disease in my liver is gone. So I am blessed to have a clinical trial that worked for me. What we know about clinical trials is that not enough Black women are in clinical trials. Less than 10% participate in clinical trials. We know that when we look at the statistics, it's about being asked, it's about being considered. I know that with this diagnosis that it is an opportunity for me to give a voice, to give a platform to women that look like me that may not have that opportunity. I've gotten so much insight for the patients that I care for through my diagnosis. Part of my journey now is being a warrior with my patients. They know that I'm going to fight for them tooth and nail. They know that whatever they need, if it is in my capacity to do, I will do it for them.
Hi, my name is Chris Dauphin. I'm Dr. Lori Wilson's husband. Of course, I usually don't call her doctor, but it's one thing to be a clinician and a surgeon like she's been and be on this side of the table, and it's another thing to be the patient.
Some of the important things that I think oftentimes gets overlooked is that our family members are in it too.
Sounds like a cliche, but we're all in this together. So it's not just the you can get that close to me without me kissing.
Cancer really entrenches itself in every aspect of your life. And this is an opportunity for women like myself to see that you can have healthy relationships and that having people support you is important. And oftentimes, I hear the words about being strong, but to have people that allow you to be not so strong and vulnerable
and that's okay too. And so I'm just very thankful